Hello, Cam followers. It is Tuesday. We have pinned the man down. Sadly, he had to kind of cancel last time because his wife had a baby pretty much whilst we were supposed to be going live.
Actually, while, yeah.
Actually, while. So we did manage to negotiate and get him back. So I'm really, really happy to have Jamie back because he is a wealth of knowledge and just oozes confidence, gets it across in a really good way. So you're going to learn loads. But before we start, I'm just going to quickly do a little big me up about the big walk. So if you guys haven't seen us advertising this, where have you been? Because it's everywhere. This is our big fundraiser for the year. We are self-funded, we are independent, we are basically trying to support ourselves with your help. It's a 30-day virtual dog walk. You will be inspired every day for 30 days with sound bites from experts, hacks from Hannah's, product reviews, CAM education, schoolroom, competitions, you name it, it's all there. And the cheapest ticket is a tenner. It's a tenner. The Garden Wanderer is a tenner. But if you want to invest in the t-shirt, the bandana, the digital assets, and the course, it's called The Forest Adventurer, and that's £70. It's a bargain. It's a bargain. It's a bargain. So please support us. I'll put you away now. One more that I have to do before you start. Pit Pat. This is our sponsor for tonight. We're really grateful that Pit Pat are supporting Cam. We love this product because it's non-therapeutic, but it's objective. And this is what we all need to be, guys, is nothing comes with a promise. No intervention comes with a promise. We have to be the observers and make sure that what we're doing is working for our dog. And this is a device that certainly can help you there. So it's an accelerometer, it's an activity monitor, and it will just let you know whether your dog is doing more or less. And it just takes away some of that subjectivity. So if you're interested, please pop over to the Cam shop. Whew, now over to Jamie. Please, Jamie, tell us all about yourself so then we can have trust in what you say.
I'm slightly sleep deprived these days. Now I have 3 daughters.
Wow.
No, so I know. Yeah, it's great fun now, but give it like 10 years and I'll probably be regretting my decisions. So I work as an orthopedic surgeon at a referral hospital in Northampton, and I work for a company called IVC on the clinical board, where we help guide our vets in what's useful and what's not so useful. So my day is usually split between orthopedic surgery and chronic arthritis management. So that's what I do, really. I did my certificate, which is a surgical qualification in practice, coming from being a GP. And then I did my master's at a human hospital, the Royal National Orthopaedic Hospital in Stanmore. So it was quite nice to get like a human slant on what goes on and see how that differs and what's the same from what we do.
Yeah, what's cool about you is that you're not just joint focused, you look at the whole body as well. So you kind of like play in the physio world as well, don't you, with a better understanding of the soft.
I think it's just one of those topics where you can't really do it properly. I think we need to reclaim the holistic word, because it's something we've been doing for a long time. You can't just look at one joint. I think people used to back in the day. They would take an Xray and say, "There's the arthritis right there," and just focus on that bit of the patient. But you can't do that. And in human medicine, they would never do that. You get the whole involvement of a whole team, including physiotherapists, including occupational therapists, looking at the ergonomics of your house, and then you've got your medications, your pharmacy, and all these things. So it's not that I think it's a very cool way of doing things. It's just I don't quite understand how you could do it in a different way.
No.
As you say, I am very cool.
You are very cool. And I bet your consults are
it's just the way to look at it. You've got to treat the whole. It's not even the whole patient. You've got to treat like the bubble.
The whole household
and everything in it. Yeah, everything in it. So it's more like the Truman Show.
It is. You have to bring all the stakeholders on board. And we, in a lot of the courses that we do, we mention the dog walker, we mention the pet sitter, we mention the kennel environment, because how upsetting would it be if you've worked really hard with Jamie and you've stabilized your dog and they're doing really well, and then you go on summer holidays and the dog has to go into kennels and undoes everything that you have done. So there are so many stakeholders. I can remember I had many dogs that we'd got into a nice comfortable state, and they'd go to the groomer and they'd have to stand for 2 hours being groomed, and that just pushed them over the edge. So there are many.
Conversely, you get people that say, I thought my dog was doing fine until I took him to the groomers, and the groomer said, my God, he's stiffer than last time I saw him.
Yes.
Because they haven't seen him for a while, and the little changes that you see every day, you don't notice. So yeah, I mean, it's exactly that. They can be a plus, they can be a minus, and if you don't think about them.
Yes, definitely. We think alike. I think he's got a lot more qualifications than me.
yeah. Always aim to have more letters after your name than in it. That's what.
Yes. No, but we've got David Levine coming in on Thursday, and he has got literally 2 sentences after.
He's got all the letters. Yeah.
He actually puts about 20 in a box and doesn't use them because it's just too long-winded. So
yeah, he needs one of those really long desks so that his name on the front.
So we're doing something a bit different tonight because we decided to be cool and down with the kids. We're having pub night. I've got gin and tonic. Jamie's got a glass of wine. We hope that you're all going to join us because this is going to be a really casual, very non-white coat effect chat. And what we're going to do is hopefully talk through some cases, give our opinions, our experiences, and just try and help guide you and inspire you. So the first thing that I wanted to tackle was, why do we call ourselves Canine Arthritis Management and step away from treatment? I was hoping that you could kind of explain this to people.
Yeah.
A lot of people go, why do you call yourself that?
Because if you called yourself Canine Arthritis Treatment, that would say cat.
Oh, yeah, that's true.
And that might cause confusion. No, it's a very good question because it's I mean, it is a bit of semantics, but I think it's almost like an awareness raiser because things that we do are treatments. But when you say treatment kind of suggests cure.
Yeah.
And it also suggests kind of definitive. And we know that both of those are not the case. So the first thing is that once arthritis is there, even in a very, very tiny amount, you will never get rid of it.
No.
And it will continue to progress so far. I mean, as far as we've got these days, it will continue to progress. All you can really do is try and optimize it and slow it down and manage it as best you can. And so I think to call something a treatment will suggest to somebody, like, if you take tablet X, the arthritis will go away.
Yes.
And that is not really true. But the other thing that I think is the difference is treatment suggests something that one person will do. So if there's a treatment, like if we have a treatment for a cruciate ligament rupture, I will treat the dog and send it home treated. Or you have to give the tablets that I say, that's treated. But management is more reactive. So I think like the difference would be, treatment might be like a sport like archery, where it's you against one thing. You just do it, you just have to do it well.
Yeah.
Management is more like how Finn Russell plays rugby. Like, he has the skills, he can do a bunch of stuff, but he has to look at what's in front of him and apply it. So to me, that's how management is. It's like seeing what you see and thinking, like, how do I apply this? How does it fit? You've got to look at the big picture. So management is a far better word.
Yes.
And I can use it. Yeah.
No, exactly. When we started out, people were like, Hannah, you really can't call yourself Canine Arthritis Management because it's CAM, and that's like complementary and alternative medicine. And we stood on toes, and it was a little bit complicated for a while. But management is a really important word in this, guys, because no 2 cases are the same. There are so many variables that you can influence. And what we're hoping by the end of tonight is that you're going to go, oh my God, I didn't realize I could do this, this, and this, and this, and this. And this can all add up to a optimal treatment plan. And Louise Clark talks about it as little gains. So she has a picture of a cartoon of a cyclist at the Olympics, and all those little tweaks that they make to the person, the helmet, the bike, the lycra, and it has these marginal gains. But when you put it all together, fantastic. And that's why we use management, because we don't want you to go narrow and blinkered. We want you to go, what can I do? Because there's a lot you can do. So thanks, Jamie. That was really important. So should we go straight into your case and then see where it goes? Would that help?
Yeah, sure. Unless there's anything else you want to talk about before. So what else
did I have on the list? I had a few things, didn't I? Management cycle term. Oh, yes. The biopsychosocial. So I love this. I heard this.
Bringing out the big words here.
I know. I heard this on a podcast many, many years ago, and I was like, oh my God, this is so arthritis management, because we have to look at what the owner wants are, the dog wants are, what are available, what are affordable. And it was really important to me to get that across to people. So sometimes I think owners feel that they are being pushed down an alleyway and they've only got one treatment option, one pathway for them, and that's really not true. So what I wanted as well to make clear is, if you are listening and you are short of time, low budget, you've got your grandma who lives with you and she's got dementia, so you really struggle to fit everything in, don't switch off to this one, because we're going to open your mind to all the different things that you can do and they can fit in your life. And I've had a couple of occasions where people have contacted me via CAM and said, I can't afford the expensive medication, I can't do the X-rays, I can't afford the supplements, I feel like I've let my best mate down. And that is far from the truth. There's still stuff that you can do. Fair to say?
Yeah, and also you might, it's prioritizing as well. Like if you've got a certain budget to spend on management of arthritis, which is realistic, you want to make sure that what you're spending your money on gives you good return for that.
Yes.
Best bang for your buck. You don't want to be frittering away your money on stuff that has marginal, the marginal gains are the icing on the cake. It's a very good analogy, but the marginal gains are things like, if I'm a cyclist, do I shave my legs to go faster? Whereas maybe buying non-steroidals is, do I need to take the stabilizers off my bike?
Yes.
So the marginal gains do come later, but you don't fritter your money on the marginal things when you can invest that in the big things. And some of those are free.
Totally agree. So I'll tell you a little.
They're better than free. They actually save you money if you feed your dog less food.
It
saves you money.
So it was a late one winter night, and I'd been asked to go and see this little old lady in Brighton, and I arrived in her flat, and her dog was very debilitated, like a proper old crippled spider walking around the place. Mm-hmm. And I asked the lady what she was administering, and which vets does she normally see, blah, blah, blah. And she didn't see the vet because she was scared that the vet would tell her to put her dog to sleep. So she just chose to avoid the vet practice. Yeah. And the array of medications were actually supplements. And she had gone to the local pet shop and she had bought 3 or 4 different supplements, with none of them that I recognised at all. She spent her whole pension on these, as you say, marginals. And it was really sad, because if she'd only had the confidence to go to a vet, the vet could have gone, right, let's put these in a box and forget about these for now. Let's look at what's going to make a big difference. So yes, totally agree.
Well, no, but exactly, because one of the common things I see is that people will do exactly that, and they'll present you with their 3 supplements the dog is on, and they tend to be the same, just with a different name. Yes. Which instantly is a waste of money. Whether that's not saying that the supplements are bad; they could be very good, but you don't need to give 3 of the same one. Yeah. And also, when it comes to not taking your dog, I know, because you don't want to hear bad news, but the longer you leave it, the worse it is. It's like looking at your bank balance. You are better to bite the bullet and check your bank balance every time you go to the cash machine, rather than just Not
at the moment, no. But yeah, so, I totally agree with that. Yeah.
Yeah, because there are things that can be done, but if you leave it right to the end, then there are limitations on what can be done. So you're better to act early.
Yeah, and that's one of the things that really triggered CAM. So for anybody that's new to CAM, it started one fateful day in Brighton when 2 dogs came in back to back, and they were both on the diarrheas, off the back legs. And that's not a diagnosis, guys. That is a clinical presentation. And for a dog to be off their back legs, generally they've actually been suffering for quite a long time to get to that point. There's very few conditions that just off the back legs. And neither of them has had any intervention prior to that point, but they'd been in for vaccines and they'd been in for bits and bobs, and the owners had never mentioned other stuff, and the vets hadn't seen. And it just made me realise that we need to educate more, we need to raise awareness, we need to give people the skills to pick up on the signs earlier so that we can do more, because there is more you can do.
Yeah.
So, major categories of intervention. So we're going to just kind of it's a bit like Kim's game. Do you remember the Kim's game, the memory game? How many things can you think of? So, do you remember that? No? I got into the brownies final, okay? The Kim's game is the tray game, where you have all the objects You allow them to
yeah. And someone takes one away, and then
take one away and you have to remember which one. Brownie's fine.
Yeah, that's good. Yeah.
So give us some categories of interventions that we're probably going to skip through in a bit when we talk about your case, so people know that we're talking about. I'm going to start off with pharmaceuticals. What's your
Yeah. Well, I've got a slide about this.
Oh, cool. Should we just do that then?
So why don't we crack on with that?
Yeah. Okay.
Excuse me if this is all a disaster. If I start saying I'm talking about the next slide and you can't see it, then just all shout out. And if you've got any questions, just lob them in. Now, we've had a practice at this.
Pretty.
And
I'll just drink some gin while I wait for you.
Right. Now,
I love the fact that there's loads of people drinking with us. This is just the way forward. Yes.
Yeah, this is it. This is the way. Can you see my slides?
Definitely can.
Right. Can you read out what it says so I know that you're on the right page?
The OA case study, the amazing Nina.
Okay, cool. That's fine. I can't see you. So you have to shout out if anything weird goes on.
Yeah.
Right. So here's the first slide. So this is a slide that I developed and I was very, very proud of. I thought it was the cleverest guy in the world for a lecture on how to do things. And then actually at the same event, someone presented an almost identical slide. So I was a bit gutted because I thought I'd come up with something good. But what I don't like with osteoarthritis so much are the flow charts, because I find those kind of put us more into that. This is the way you must do things. And I don't think it quite works. Whereas this, I like, because it's basically saying the things at the bottom are more important. You have to have the foundations in before you can build the things on top. What's interesting is this is the way I think about it. The slide that was put up was actually by a CAM nurse, and it was almost identical, but in slightly different orders, which I think is just how our roles are slightly different in the whole.
You're a surgeon and I'm more of a first opinion. So
yeah, exactly. So basically what I do is I don't do anything until I've done the thing below it. And then I can move up. So often I'll do a bunch of these all in the same consult on the same day, but I've got to do them in the right order. Otherwise it affects my well-being. And sometimes if you feel you've got problems, you have to go back down the mountain, sort it all out, and then head back up the top. So for me, the first thing is early diagnosis. And that's two important words. The first is you've actually got to diagnose it, because there is a place in some animals for making a presumptive diagnosis of arthritis. There is a place for that. If they are so unwell that you cannot sedate or anesthetize them for radiographs, or if the owner really cannot afford that, then I think that there is a room for a presumptive diagnosis. But really, if not, you need to know for sure, because like you just said about dogs that are off their back legs, there are things that do that are not arthritis, and you don't want to be treating the wrong thing. But the other thing is early, which is again is what you just said. You don't want to be dealing with this when they can't walk. You want to be dealing with this as early as possible. And that gets a bit controversial because, like I said, as soon as you've got a teeny weeny bit of arthritis in there, you've got irreversible arthritis. And that's not always what people want to hear when their dog is 7 months old. And if you don't say it right and you don't explain it right, you can get, this can be a big trauma for people. And also then they kind of opt out. They think it's the end of the world. But it is so important that you catch it early. And then, because I'm a surgeon, is there something I can do now to intervene? I can't stop arthritis. But for example, if the arthritis is developing in the knee because you've got a cruciate ligament failure, then there is no point in me throwing stem cells and medications and heat packs and things at it, because it's going to progress at a high rate unless I stabilize the knee. Or, if there's an elbow problem going. So before I even start, is there something I can do that attacks the primary cause? Because osteoarthritis in dogs is pretty much invariably secondary. There has to be a reason why it's there. So can I address the actual reason? So once I've got all that out the way, then we have to explain to the owner, what does this mean? What's going on? This is a progressive condition they're going to have for their whole life, but that's not the end. We have to manage it in the best way, all these things, and also make sure that they understand what is going on when the dog is stiff or lame. He's not in pain, he just limps, that thing.
Did you see my Blunt Monday this week? I
I
do blunt Mondays. So every Monday I say something quite facetious and outrageous just to try and get people's ears to prick up. And it was like, I've never known a dog to limp for fun. Well, not any of my mates anyway.
No.
And it's true. You know, they don't limp because it's cool. They're not doing a swagger.
There are two types of lameness. There's mechanical and then there's pain.
Yep.
So mechanical is if one leg is shorter than the other, for example.
Yeah.
And pain is when it hurts. So yeah, I mean, this is the thing. So then my next stage is correct body weight, diet and exercise regime, including omega-3.
Yep.
So these are all probably happening right in the first consult. It doesn't mean I instantly make the dog the correct body weight, but I address it right then because it is so crucial. You know, you can have such an effect on improving the outcomes just by reducing body weight to a healthy level. And that involves a lot of education as well as awareness raising, because people have an idea of how a dog should naturally look, and that's just the average of the dogs they've seen. And if you look at dogs, I mean, not picking on anyone, but for example, Labradors that we see in adverts and at crafts.
Yes. People get upset when I say the Antrix puppy's a bit chubby. People don't like that.
Yeah, no, because that's how our perception of Labradors should look. You know, that's what we imagine when, if you ask a kid to draw a Labrador, they don't put the ribs in, do they? No. But it is important that not only do we say that's not the correct weight for a Labrador, but also I want them on the slim side of correct. And you know, a difference in they did that really good study, I think it was in Glasgow, of a reduction in body weight for overweight arthritic dogs was almost as effective as the non-steroidals.
Yes.
In terms of improving pain. So that's something, like we said, you can do for free. It actually saves you money.
Yeah.
In so many ways. It saves you money on dog food. It saves you money perhaps on medications that you don't need. And unless you address that early on, the rest, maybe you're kind of, you know, fiddling around the edges. You need to get in there early. And omega-3, which I always witter on about, but it's the thing with a lot of evidence.
Strong evidence behind it, definitely.
Yeah, and I mean, if you think about it, it actually acts in the same pathway as the non-steroidals. So, of course, it makes sense. Then I have correct pharmaceutical analgesia, bearing in mind that correct might be it doesn't need any pharmaceutical analgesia at this point, which would then be correct for that dog. But usually they do need some analgesia. And you have to keep coming back to that. And I think that's a big message, is that what's correct for them now may well not be correct for them, you know, in a year. You have to keep coming back to that. So every time you're working your way up, but then every time you see them, you're kind of having to go back down and checking your work. Then we talk about physical therapy. So physical therapy is massage, hydrotherapy, heat packs, lasers, basically
therapeutic exercises, a lot of postural work.
Non-pharmaceutical interventions and environmental changes. So that's what Cam is so good at talking about, you know, the slippy floors and the wooden stairs and the jumping out of the back of Range Rovers. And you know, so already this is a massive amount that's gone on. And then if you're not happy with all of these things and you've readjusted your pharmaceutical and everything like that, that's when I start talking about intra-articular therapies. And then on top of that, at the end, you've got salvage surgery. So salvage surgery would be like a hip replacement. Now, that doesn't mean that hip replacements come at the end of a dog's life. But hip replacements might come early, but you've got to make sure. You've got to make sure that you've kind of addressed all these things. So that's broadly how I think of things.
And I love that because it's so the same as our pyramid with a few adjustments. And we call it the pyramid of influence. And it's the empowerment pyramid, because many owners will go to a vet and it's no one's fault, but the speed of the consult, the busyness of the waiting room, you know, people only take home 25% of what a vet is going to say to them in that short period of time. And they come out feeling a little bit unempowered and feeling like they've become dependent on somebody else's advice and prescription. And we want that pyramid to show owners you can do so much, like the early recognition, the objective monitoring, the weight control, the exercise, the home adaptation. You're in charge of way more than that vet is, and you should embrace it and let us help you. So yeah, we use the same pyramid also as an empowerment device, really.
But I mean, also, if you think about it, compared to a human model, then in the human model, you'd have the consultant who you would see maybe twice a year. That would perhaps be the vet. Then you have your GP who looks after your everyday health. And the GP maybe is the equivalent of the owner. Because you're like the one seeing day to day all the changes. So yeah, that's the way I try and manage things.
Just butt in. I can see all your questions, guys. We're not ignoring you. They're amazing questions coming in. But I'm going to let Jamie.
I'll do my slides.
And we'll come back to them because they're really, really cool questions. But yeah, don't think we're ignoring you.
What I'm going to do is I'm just going to talk through one case study, because I essentially have one patient that I think pretty much covers everything.
Perfect.
And this is her. She's the little one at the bottom.
No way, little cutie.
Yeah. So she comes from a family that always had black Labradors, and she was a very sweet little dog, and she has a twin sister that she lives with. And they're beautiful dogs, but she developed a limp fairly early in life on the front leg. So this was the first radiograph that we have of her. And what you can see, you cannot see the prime problem here. So this is a dog with what people sometimes call elbow dysplasia. So fragmented medial coronoid disease. And you can't actually see that on the X-ray, but what you can see is the secondary changes. Now, can you see my pointer, or is that not visible? No pointer visible. So what I can see is in the elbow, underneath the elbow joint, there is a very white area that shouldn't be there. And that's the body buttressing that bone. So it's taking unusual stress. What you can also see at the back of the joint, where one bone overlies the other, is that the bone surface is slightly scruffy. And that is early osteophytes. So this is a joint in a young dog that shouldn't have these changes and does. So we know there's a problem. And in those days, what we did was just arthroscope it. We would now CT, but we didn't have CT at that point. So this was a little while further down the line. Now, at this point, she'd initially had the treatment where we'd said, okay, we see a problem. We started off as usual with let's rest her, let's give her non-steroidals, and let's see if this is actually just something that, because, you know, dog, especially puppies, they charge around all over the place. You know, they're going to hurt themselves all the time. But we'd gone through that hadn't worked, and we'd taken our radiographs and we knew that there was an elbow problem. So we then thought, well, is there anything interventional we can do? So we put the arthroscope in and found this fragmented medial coronoid, which you can remove, which will improve pain. It doesn't affect the progression of arthritis. And what we've done in her,
describe it like a stone in the shoe, don't they? That's one way.
Yeah, like a pebble in your shoe. What you can see there, the reason that the bottom bone there, the ulna is a funny shape, is because what we did in those days was we would cut it. We'd do an ulnar osteotomy. We would do something slightly different now. But what you can definitely see there is that there is progression of osteoarthritis. You can see how fluffy and ugly that joint is.
How long later was this? Because I think a lot of people don't realize that when their dogs get diagnosed, then generally near end stage, and people are like, what?
So as I remember, the one on the left, she was probably about, 12 months.
Yeah.
And the one on the right, I think, was about 6 months later.
And that's the thing. I hope I can get hold of some images, because it will scare the hell out of people. But what you see on an X-ray, if you were to then look at the joint via an arthroscope, looking with the camera, you're going to see red, like bone.
Yeah.
The cartilage is gone. It's going to be loads of the synovial line. It's going to be all angry, and people.
So what? Oh, sorry. Carry on.
Well, people think that just a minor change on an X-ray means, oh, it's just early arthritis. Well, no, actually, even when you get the change in the X-ray, it's very well developed, isn't it?
Yeah, well, I don't know if I've actually I might have the images from the arthroscope there. On the one on the left, what you'll see, the difference between that and a normal joint. On that one, compared to a normal joint. A normal joint is nice and bright. The synovial lining is kind of pale pink, and the cartilage looks like, when you go in the park or on a hill and it's snowed and no one's been there. It looks like that. It's just smooth and white. It's beautiful. And if you scratch it, it makes a scratch like in the snow. And then the one on the right, what you'll see, the one on the left, what you'd see that'd be different from that would be synovitis. So you get like these red fronds coming wafting in the joint. And then the one on the right, what you'll see is much more of that synovitis, but also you'll see track marks where the cartilage has worn away and you can see bone underneath. And that's where some of the pain comes from, because you're either getting synovial fluid hitting the bone, which hurts, or you're hitting bone against bone, which really hurts. But what you can't see on an arthroscope is the stuff outside the joint. So if you were to, it would be a bit mean, but if you were to saw the joint in half, you would then see the changes, like the thickening of the synovium, the changes in the muscle, the osteophytes. So again, even with imaging, you've got some modalities that are very, very good, but you have to use with other ones to get the full picture.
Yeah, I think Karen Perry Butler was the person that told me something that just blew my mind. She had done a total hip replacement, and the joint capsule of the hip, which should have been no more than a few millimeters thick maximum, was almost like an inch thick. She said it was like carving through it. So no wonder these dogs are not only stiff, incapable, and painful, because the structures around the joint dramatically change too.
Yeah, they thicken right up, and they're kind of like friable. No, they're nasty. It can be really, really thick. It's almost like, I don't know, like orange peel or something thicker. So this is what then happened. She was due for a resurfacing procedure. So at this point, what have we done? So we've done the arthroscope, we did the ulnar osteotomy. We then made changes in the house. So she started using a ramp to get in and out of the car. And we had mats down in the house because she was beginning to struggle a bit. And as that progressed, she was doing hydrotherapy, and she loves hydrotherapy. But then we were seeing that she was still deteriorating. Now, this was still quite a while ago, and we did have more limited medication choices. At this point, we'd started her as well as the non-steroidal amantadine. We were then saying that she was, at this point, not doing brilliantly. She was on Hill's JD, which is the high omega-3. Other brands are available. So we were already doing quite a lot. So she was having physical therapy. The owner was doing heat packs on the elbows for me, warm up and warm down. So morning and night, and before a walk and after a walk if it was a cold day. So we're already putting a lot of this in. But we were still seeing that she was exceptionally lame. So we were lining up a resurfacing procedure, which is called a Q, where you take that sore part of the joint, you drill it out, and you put in like a false joint surface. But a week before that, she became extremely lame, and they thought she'd broken a leg. And what had actually happened is she had a joint sepsis. And that's what you can see here. So joint sepsis is where you get infection in a joint. And the classic one would be, like a stick, splinter, or a cat bite puts bacteria into your joint. But more realistically, what you see is when you have arthritis. So bone is very beautifully designed, and you can see it down there on the left. It's almost like lace or something, and it's beautifully efficient, and blood flows through bone, and it flows through bone like your heating pipes in the house. And because they're smooth and they're clean, you don't hear the heating. But when you get lime scale, you hear it because it's turbulent. Now, when you have bone that is their correct bone, normal bone that is developed for walking around, everything is smooth and uniform. When you have new bone put down because of arthritic change, it's random. So osteophytes, it's random, and all the blood vessels that are associated with it are really tortuous. So it's like your dodgy heating pipes. And what happens then is, because instead of flowing nice and smooth and fast, the blood is going through all these different like narrow passages. Any bacteria that you have circulating, and we all have bacteria circulating sometimes, like if, for example, you have, I don't know, ear infection or skin infection, and that flows around your body, and because it keeps moving, your immune system just catches it and takes it out. But in these cases, you've got these little corners and crannies where it can lodge. And so infection precipitates out in places like if you've had surgery or you've got an injury, but specifically here. So dogs with arthritis are more prone to joint sepsis. So this happened just bad luck.
That is painful.
It's really, it seems like a fracture. They're that painful. So obviously you can't put any implants into a joint that's had sepsis once, because it's so prone to doing it again. So she was treated directly for that. So that's flushing the joint, long course of antibiotics.
Well, and how long is the course, just so people are prepped? Because I think people get really blown away when we say
so usually for this, I start them on IV antibiotics, and they go on like methadone and ketamine drip for a couple of days until the levels are up. Then they get the oral antibiotics to go home with. And I normally do that for 6 weeks. And then I take a second joint sample, because you're sampling the joint fluid to diagnose. And if you don't see changes at that point, you can stop. If you still see changes, you carry it on until a good 2 or 3 weeks after you see no changes. So this is a long course, because it takes that long. You've got to imagine this is really dense bone, and we've said it's got a dodgy blood supply. So for the antibiotics, that's all carried by the blood. So to get to the antibiotics in the right levels in those tissues to eliminate all the bacteria, it takes a long time. So that's why.
Good.
And that's what it looks like on the front. I mean, it's pretty horrific stuff.
Yeah,
that's not what a joint should look like. And you can also see the very narrow joints. People say joint space narrowing, which is not, I don't like that term, because there is no space, really. The space is like a couple of microns thick.
Yeah.
It's like a couple of molecules of joint fluid. The space you see is where the cartilage is.
Yeah.
So joint space narrowing means cartilage loss.
Yeah.
And you can see how narrow that space is.
And how old do you think she was at this point?
Oh, I don't know, 3 or 4.
And this is something that really needs to get home to people, is because people just so link arthritis to older dogs. And, so this pup has been burdened with this for life, Yeah.
And then what happened to her, bless her, is that she then got problems with her back legs. So this was her having, now this is where it gets interesting, because obviously she didn't have elbow disease in her back legs.
No.
So do we have dogs that are prone to joint injury? Was it that she was taking more stress on her back legs? I don't think so, because she was doing a lot less activity than a normal dog. So what's interesting is, do we have a genetic component, or is it something within that dog that makes them prone to osteoarthritis? So there's a lot of research going on at the moment into the genetics, into the microbiome. So your gut flora. So I just put that in out of interest, because bless her, this is her. Oh, you can't see that video. Where did that go?
Try again. We did.
Try again. Saw it briefly. Right. Don't press too many buttons.
So just tell them about the Xray that you've got here, though. What are you Xraying?
That was an arthrodesis that we did of her back leg. So you can see her walking now, and you can point out a couple of things. Obviously, you can see which elbow is worse. It's the left. They go up on the bad leg, like your pebble in your shoe. You go up.
So turned out.
Yeah. But you can also see that although she's struggling a lot, but she is happy. She's a happy dog. She's still happy. So at the moment, she's still on her food. She's still on her physical therapy. She loves her hydrotherapy. She loves to swim. She is on a non-steroidal. The amantadine, we actually took her off because it started making her feel a bit weird. And we put her on gabapentin. So gabapentin and amantadine are like sort of supplementary analgesic drugs that act centrally. And they both act in a slightly different way. And they're both pretty similar, to be honest. And some dogs just do better on one than the other. And some do better on both. Mm-hmm. So
let's just spend 2 minutes there, because that's really important that people should know. In that, again, nothing comes with a promise, and you have to trust your vet and be willing to give things time. So it's not uncommon for someone to say, right, we're going to start on, say, amantadine. It's going to be a good 4 weeks. We might adjust the dose. We might increase the frequency. We might add another thing. But you've got to trust me that we're working on this together. And I think a lot of owners go to vets thinking it's like a light switch. You take a pill, it's going to be fixed. But you have
and also,
to have a rapport, don't you?
Also, you need to give it time. These are some of the drugs that we have act very quickly, and that's wonderful. And some don't, and these ones are more slow burners because they're sort of modulating the way pain is perceived rather than the actual problem. So what happened with the amantadine, as well as making her seem a bit spaced out, the owners were basically saying, and I was kind of agreeing, that she was good and now she was not so good, not as good as she'd been before. So she'd been on it for quite a while. I think a couple of years, and then we switched to gabapentin and got a better outcome. So yeah, I just try one, and if that doesn't work, but you do have to take a long time. And again, it was the right drug for her at one point, and then it wasn't.
Yeah. I was talking to a rep today about that, and how it is so difficult for vets in the very limited time that they have to talk to owners about swapping medication. Now, roll with me on this one. With an owner that's on, say, a non-steroidal, in many ways, psychologically, it's easier to add to it if it's not getting the desired effect. In many ways, it's harder to say to them, I don't like that drug anymore, I want to change it. And they'll be like, well, why did you give it to me in the first place? If you don't like it, why didn't we go on that one in the first place?
Well, so non-steroidals are a classic for this, because, I mean, to be honest, these days, there are no bad non-steroidals.
No.
They're all good. I mean, there are some that I think maybe have some advantages over others. There are a couple that I just am so familiar with, I tend to use those first. But we also know that some patients just react better to some than others for no reason that we know. So I think there's a few things about non-steroidals. One is, if they don't have the response that you would expect, if you're expecting better, after about 6 weeks, exactly say, well, I do like that drug, but I'm going to try a different one just to see if she responds better. Because it's not just you've tried one non-steroidal, you've tried them all. Pretty much you have, but some dogs respond differently from one to another. And likewise, when dogs don't get on well with non-steroidals, what I hate is when it says there, dog can't take non-steroidals. First of all, is it just one they can't take? In which case they might take another. Secondly, are you sure it was the problem with the non-steroidal?
Yes.
I see this for dogs where they've been on a non-steroidal for 9 months, and then they get vomiting, and then they get taken off it, and they're told they can't have non-steroidals.
No, they just pick something up in the park.
Allow dogs to vomit once a month, because that's what they do. And so they're going to vomit once a month without any medication. If they vomit once a month when they're on the medication, maybe it's, I mean, I know you guys, you're so good, you check what your dog's eating, all these things, but then they go and eat like week-old KFC in the park.
Yeah,
it could be absolutely nothing to do with it. So usually when I get a dog with vomiting, diarrhea that's on a non-steroid, the first thing is I say, well, stop it for a few days and then start it again, because it's a good drug, and I'd hate to lose it from our arsenal forever for no reason. Start it up again. If you still get vomiting and diarrhea, we'll stop, we'll wash it out, and we'll try a different one. And then, maybe after that, then I'm going to stop.
Can I just butt in and just big up the course? So we've got a CAM owners course. So a couple of people have said to me in the questions here, what can I do for my dog? So they're obviously quite new to CAM. Please take the time to do one of the owner courses. So the CAM Essentials, it's 12 modules, but it equates to no more than about 4 hours. You sit there with your glass of wine, your cup of tea, and all of these topics are covered. So this category of the non-steroidal myths, there's a whole section about using non-steroidals and a lot of the stories that are circulating, and is there any truth behind them. So please, it's 20 quid. It's an absolute bargain. If you're a member of Holly's Army, you get 25% off. So it's 15 quid, and it's going to equip you with all of this kind of information so you're prepared. Please continue.
But speaking as someone who treats osteoarthritis every day, non-steroidals are brilliant. And they're still brilliant even when someone invents a very, very brilliant new drug. Non-steroidals are still massively important. They are fantastic drugs. If someone invented them now, we would all be amazed. They're fantastic. There's no such thing as a free lunch. Every now and then you get a dog that cannot tolerate them, and every even rarer than that, you get a dog that gets sick from them. But we have so many dogs whose lives are so much better because of them, that for me it's a no-brainer, unless there's a real reason they can't be taking them, that they're pretty much pharmaceutically first line.
And I was
So
thinking about this the other day, in that I spoke to Dr. Mike Petty, and he is over in America, and he was one of the first people to do promotional work for Rimadyl back in the day. And Rimadyl was like the first. I think you called it Xenacarb.
It used to be called Xenacarb,
Yeah.
Which sounded better. I think Xenacarb is a much better name. Xenacarb sounds like a superhero. Rimadyl sounds like a Morris dancer.
They're gonna not like you for that. Anyway, I can't believe how difficult it must have been seeing these old dogs and not having anything in your arsenal. And that was only what, 30 years ago?
Well, when I graduated, which was not quite 30 years ago, but nearly, they were still the magic drug. They were magic, because you'd have dogs still on the old drugs or on no drugs, and you'd have those situations that you described, they never had any treatment, off their legs, come in to be put down, and you would give them the magic drug and they would get up and walk the next day.
Yeah.
Obviously, it's not the way we want to do things, but it is pretty cool. And compared to any drugs that came before them, they are massively safe.
Yeah, absolutely. And this is
the
only
one before that was a drug called PLT, which is a good drug, but it had way more side effects. Yeah. So these are a good drug, considering how long dogs are on them and how many dogs for how long. Side effects are low. Yeah, and the other thing I would say about this video is that she's struggling, but she's out for her walk and she's wagging her tail. So people worry about how many tablets their dogs are on. Should they on too many? The dog can be on as many tablets as they like. As many, they can rattle. If they are happy, I don't mind putting in extra drugs. I'm not in the business of dragging dogs' lives out.
No.
And when people come in and say, "Oh, I don't want him messed around," of course you don't want him messed around. No one's going to mess your dog around. But if adding in an extra drug is not a bad thing, if there's a reason for it. One thing I'm a bit averse to is because I've been doing these talks and things like that, and people are kind of getting the message, but you're seeing dogs as soon as they're diagnosed with arthritis being on all the drugs, and that's maybe a little excessive. I'm not too much a fan of that, but add them in slowly, give them time to see the effect, and then modulate. So you're coming up with an individual cocktail of drugs. That sounds bad. Individual.
No, but it's true, and that's why I
think regime of drugs.
I think Chris Capon said, do you remember back, it was a few years ago, and he stunned the room at one of the BSABA conferences and just said, owners are not stupid. They do need to know things. And I totally agree with him. Yeah. And that's why teaching owners what these drugs do in a very simplistic way will give them confidence that they're not just layering upon layering the same drug. You're not. They work in different parts of the pathway. And I think once you know that, you're not so scared of it.
I think one of the main things that I pick people up on is when they say, "Oh, he's been on Metacam for years, but it's stopped working." The Metacam has not stopped working, or the non-steroidal, sorry. It's not stopped working. It's working as good as it ever worked. It's that the disease has got worse. The pain has got worse. So the Metacam is doing what it was doing 3 years ago. It's just the pain has got worse. So what you don't do at that point, stop the Metacam and give something else. You continue the Metacam, the non-steroidal, and you give something else. So whether they're on Previcox, Metacam, whatever, Rimadyl, it's not the time to stop it. It is if you're going to replace it with a different non-steroidal, but you don't take it out and say it doesn't work and try another drug. And this is having fun. So this is another thing, bull chasing. Bull chasing is tough on elbows, but there are some dogs that love chasing bulls, and she is one. So she can't run and chase a bull in the park, but she was miserable. So she carries a bull on the walk, and then the bull gets thrown in the lake so she can swim out and get to it. And she loves to swim.
Yeah, I'm glad you said about the bull frame, because I actually have been called the bull police, and when we got into the national newspaper about it, I actually got hate mail. That's my claim to fame. I got hate mail, but it's such a
simple... that reminds me, because I throw a ball for my whippet when he's not being lazy. Yeah, he loves chasing a ball, but he has no osteoarthritis. He's perfectly healthy.
Do you warm up and warm down?
Yeah. So what we do with this guy is, he walks to the park, he runs around a bit, and then we throw the ball. If he had arthritis of the elbows, there's no way I would be doing it. So it depends on, dogs are designed to run around. They're designed to do crazy things. but that's when they are healthy and they're working properly, and you just have to
And
change
fit.
things. So it's not cruel to throw a ball for your dog, but if your dog has bad elbows, why would you do that? Why would you make it worse? So you've just got to think. Now, in that case, usually I just say don't throw the ball anymore. Ball throwing is gone. If you have a dog who is going to be miserable, then you can come up with these different ways of doing it.
Yes.
So in the lake, it's fine because they can swim out, provided not clambering over rocks. They can swim out, get the ball, and they're happy. And the same is with stairs. You know, we say don't do stairs anymore. But there are some dogs that if you don't let them upstairs at night, they feel they're being punished. You know, they're miserable, they get depressed. In which case you say, okay, he can go up at night and down in the morning, but you have to put your hand on the collar where he walks, he doesn't leap. Or you put the gate there, you know, so you have to apply it to the dog.
But that's like everything in life, isn't it, though? Everything in life is an element of grey. And, black and white isn't possible. But I think being able to say to people, think, look at what your dog's body does and how fit is your dog. So if you've got, say, a French bulldog that's already got some like breathing issues, they've got an extra lumbar vertebrae, they've got maybe hip dysplasia, and they're unfit because they don't exercise very often because they're a little bit of a plodder, you're not going to want to start throwing a ball with a ball chucker with that. No way. No. That's just not cool.
Especially not on a hot day. No, exactly. And usually when you're talking about exercise with a dog, because often these dogs are very young, not always, you've essentially got to balance what is good for the joint, which would be sort of low impact, moderate exercise. So ideally for the joint would stay in bed and go for a swim 3 or 4 times a day. And then you've got what is good for the dog, what the dog would want. The dog wants to be flat out chasing bunny rabbits all day. And you've got to pick on your line. Where's the golden point for that dog and that owner? You know, if you've got, say, a 14-year-old whippet, they'll be fine with 3 times a day around the block on the lead. They'll be fine. They're happy with that. And that's really good for their joints. If you've got a 2-year-old Labrador, if you apply that approach, you're going to end up with a dog leaping around the house, crashing into furniture, maybe with behavioral issues. So you can't have them that close to the end. So you have to compromise. And where is the compromise? You know, it might be that they need more exercise and therefore more medication. They might need even more exercise, and you say, I realize this is going to be a shorter life, but maybe a happier one. And everything is a balance. And like you said, you've got to apply it to that particular dog and that particular owner.
And I think that's really important. What we try to do with Cam is we try and highlight these variables. And then the onus is on the owner to say, yes, I buy into that, I don't buy into that. And the one that drives me mad, and I'm going to probably offend loads of people, is the flooring. I do get really annoyed when it's so obvious that the dog's struggling in the house and all you need to do is put a rug down. I sit there going, oh, come on, guys. Just a visual thing. And but we do try and say, right, these are all of your areas that you can modify. And it is a bit of a pick and mix. And you get some owners that do absolutely everything, and some owners that buy into other bits and bobs. And it is dog dependent, owner dependent, biopsychosocial.
Yeah, and also you get some people who own dogs and are retired and they're with their dogs 24 hours a day. And you get some people who aren't, who are very busy, who have kids, you know, and there's a limit to what they can do. But I mean, with the flooring, we're not saying that expensive oak flooring you put in for £20,000, rip it out and put, carpet down. But the way to persuade people is you start off, feed your dog in the kitchen. Okay, so put a rubber mat under his bowl that's big enough for the bowl and the dog. You see where he stands. He'll stand on the rubber mat. He won't slip. So there are things like that, interventions that the owners can do at home, like heat packs, like passive range of motion exercises, like how you exercise your dog, avoid a sedentary lifestyle. And those owners of Nina, fantastic, because they're so dedicated. And, you know, we know each other so well now because it's been a long time. So every time I see her, we're going through this, you know, is there a surgery? Is her weight okay? Is her diet still all right? Is the correct medication that she was on the correct medication? Is she not now? So latest is now we're going to introduce, because she's now deteriorated a bit more, the Librela. because she's.
Can I get rid of
she's
your
doing-
pyramid so that I can see your face? Are we done with your pyramid?
Oh,
Yeah.
there she
There you go.
That's her being happy.
There
Well,
you
I
go.
think that's the end anyway.
Yeah, because then
Yeah,
you'll
because
be
I
a
have
bit
no
clearer.
idea what's going on here.
So tell people
right.
about the Librella, because it is a difficult situation in that we are under strict guidance that we are allowed to talk about medications in a very generic way, because we need to make sure that owners speak to their vet about their case. So please don't think that this is a publicity act. This is us just raising awareness that there is another kid on the block. Talk to your vet about it. But so what's your feelings?
So, yeah, I mean, the bottom line is that we are not allowed to advertise specific drugs to the public. And that's the same for doctors in this country. You'll see sometimes you go abroad and you'll see TV adverts like, you feel poorly, ask your doctor for this antibiotic. And that obviously just puts a doctor in a bad position. So you can always talk generically about, non-steroidals, what's good, what's bad, what you should do, all these things. The problem we get is you shouldn't recommend one non-steroidal over another to the general public. It's up to the vet to consider all the different applications. The problem we've got with this particular new drug is that there is only one in the entire class of drugs. So if you're talking about the class of drugs which you're allowed to do, you are specifically talking about the one drug which you're not supposed to do. So I have no, I'm not paid by Librella in any way or anything like that.
No.
So what it is, up till now, we've been managing with all those medications I was talking to. You start with the non-steroidals, and then they work in two ways. One is they reduce inflammation in the affected joint. Well, they reduce inflammation everywhere. It's just that that's where the inflammation happens to mostly be. And so if you're reducing synovitis, you're reducing sort of pain output, like the volume that the sound's coming out, if you like. Yeah. And they also have a small central effect up in the like in the central nervous system, in the spine, on pain. So you have those. And then we had the gabapentin and amantadine we're talking about, which are human drugs. They're not actually licensed for dogs. They're generic human drugs that we use a lot. And what they do is they act centrally in the brain, modulating how the pain is perceived. So they work more on the wind-up pain, the chronic pain, which is where the pain amplifies over time, which is something that still is kind of poorly understood. So if you have the same amount of arthritis in one joint for 10 years, the same level of arthritis going along like this, the amount of pain you get increases, or the amount of pain that you perceive. People say pain is all in the mind, and that's a bad thing to say. Well, it's true. It's true. It is all in the mind.
Pain is in the brain. Yeah,
everything you do is in your mind.
Gwen explains it very well. She talks about the pain budding off, in that you end up having one disease at the beginning, but then you almost feel like you're dealing with two, in that you've got your arthritic, nociceptive type pain, but you've then got this little Klingon pain who's doing a different thing, and you have to kind of think about how to treat them differently.
It's what we call maladaptive pain. So it does become in itself its own condition. And so it's just like someone's turning up the volume knob the whole time. And so amantadine and gabapentin interfere with how pain is perceived in the brain. And they're actually used for other things primarily, and this is just an effect that they have. So we use non-steroidals initially in early stages, because as well as reducing pain, it's actually, kind of reducing inflammation, and that makes sense, especially in the early stages of the disease. Then when you've got this wind-up pain, this maladaptive pain, we would use something like amantadine or gabapentin to deal with that. So dealing in a separate way at a separate type of pain, or a separate part of the pain process, if you like. Now, the maladaptive pain is not just how you interpret the pain. It actually is physiological changes. So the nerves themselves change how they transmit the pain. They amplify over time. But also, the body grows more nerves into the affected area of the joint. So it's actually perceiving more pain, which is then being amplified. And that's how this maladaptive pain comes about. Now, one of the factors that controls and drives this process is called nerve growth factor. And nerve growth factor is a good product in your body. It's naturally there. It's a good product in your body when you are a baby, because it grows your nervous system. which is a good thing. But later on in life, it is associated with this. So what they've done massively cleverly, I mean, this is just genius, is so antibodies are your body's defense, things that go out and catch things that are not part of you. So if you have a flu virus in your body, the body recognizes it, sends out antibodies, and they catch it and they kind of pin it down, and your immune system can deal with it. So they have created dog antibodies in a lab, which are dog antibodies, normal dog antibodies, except they are against nerve growth factor. So if you have an arthritic dog, it will take out this factor that amplifies the pain and changes the anatomy to make the pain worse. Now, and that's what Librela is. It's antibodies in a bottle. Now, antibodies, usually you're producing them the whole life, because as soon as you're immune to something, whether you're vaccinated or you've had a disease or whatever, your body produces a certain amount of antibodies, so it's ready to recognize infection. And when the antibodies break down over time, you're producing more the whole time, so you don't notice. You've got a steady state of antibodies. And antibodies last kind of about a month in the body before they're broken down and replaced. But these are ones that are not replaced, because obviously the body won't create antibodies against its own product unless you have an autoimmune disease, which obviously is something different. So that's why you have to inject this product once a month, is because after a month it all breaks down and you start again, you just put more in. So what it's doing is it's targeting the wind up of the pain, and it is preventing or reducing the anatomical changes in the nerve population that are growing into these joints. So it is affecting the wind-up pain and the neurogenic pain, so the pain caused by nerve changes. And to be honest, it's kind of tricky to point out how much of the pain is neurogenic. In the early stages of arthritis, when, say, for example, you've got early hip dysplasia, it's mostly all inflammatory pain, because it's the inflammation, the stretching of the tissues and the cartilage and the rubbing and all this. Later, there's more neurogenic pain. And now we've got a product that goes against it. We see quite what the balance is.
Yes.
Nathan Live, it's massive.
It's massive, and it's given me so much more kind of respect for how much dogs put up with. Good God. You know,
so
some of these
I've been using it
dogs,
for a while, and what I'm seeing, I mean, in my experience, is that the dogs don't seem to be less lame when they're on it, but they are happier and more active. Almost immediately. So this is a very, very clever product. It is not the treatment for arthritis. It doesn't make everything else we've done redundant. Not at all. It's a massive, big tool in our armory. It's huge. I love it. But someone asked me that I was writing some guidance for some vets, and someone picked up and corrected. Should we take non-steroidals out now that Librela has made them redundant? No, non-steroidals are still very good, especially early in disease. I would still pick non-steroidals in early disease, definitely. And also you can use them in tandem, because they're doing different things. Again, they're affecting different parts. Now, in humans, there is a problem with using them together. Humans have to use a slightly different drug anyway, because you have to use species-specific antibodies. You can't put Librela into a human, but they have one. But if you use theirs at the same time as non-steroidals, there is an increase in a particular kind of fast progressing arthritis that humans get, that dogs don't. So although they can't say it's not,
I think it was about 29% of people. I think it was in the 20s, so it wasn't everybody had that reaction as well.
That's why that's why they advise against it in humans. And again, it would be going a bit off license, but you can use the two together if you don't get the result. But actually, the Librela that I've used so far, a lot of dogs actually are coming off non-steroidals. They're doing so well. So it is a very clever drug.
I think it's very clever. I think we've still got a lot to learn about it.
Every case, but
I think giving people a heads up and just being a bit of a realist, it is very, very new out. It only came out beginning of this year. And I know
they've had it in America for a few years more than us.
I don't think they had it in America. A lot of our followers on Holly's Army haven't got it over in the US.
It was released in America first.
Right. Yeah, there's quite a few people in the US that can't get hold of it. But anyway, what we're seeing in Holly's Army is that there's a lot of things that we don't know about it yet, and whether some adverse events are really linked. Is it linked to the Librela? So there's been a few people saying increased thirst. There's been a
Yeah,
few.
well, someone said this. You guys asked me. Someone asked about increased thirst. I've not seen it, and I spoke to the manufacturer, and they said it's not being reported. They do a review after 6 months anyway.
They're going to report
if
it
anyone
out.
sends in any things that they've noticed. So thinking about it in a few ways. I mean, first of all, because it's a biological product, you kind of, nobody knows how something affects the body. The body is really complex. I can't see how it would cause increased thirst directly, but you never know. But you've also got to think there are a few other things. A lot of people started this drug in the spring.
Yeah.
And then we had a heat wave. And then these dogs were being more active.
Yeah.
Maybe they're thirstier. Maybe they are taking more trips to the water bowl because they can. Maybe it is making them thirstier. Maybe they also have other diseases going on at the same time. These are often elderly dogs. So it is important. I think if you think this is going on, mention it to your vet. They'll probably do something like run blood screens and urine.
Yeah. But there's so many other things, like we could get really caught up, like about the Hawthorne effect. As soon as somebody starts being watched, they kind of behave differently, and as soon as an owner becomes more observant, because it's a new drug, they're going to watch more and they're going to pick up more things. But I think my kind of take home for people is, be observant, note down anything that you think is something that you want to talk to your vet about, and have that chat and get it written down, get it reported, so that we can learn more about it. Because we want to know.
It's a big change in how things are being treated, and it is very clever, but it is important to realize what it's doing and what it's not doing. It's not making the arthritis go away. It's not treating the arthritis directly. It's treating the changes in the pain, both the physiology and the anatomy.
To something that you'll be very passionate about is then seeing people that allow their dogs to just go crazy. So the dog's been educated for a long time, and then suddenly they
can do more, but that doesn't mean like take them marathon running. No. But it's good that they play, because number one is avoid a sedentary lifestyle. So there are some dogs that are being actually able to do the kind of level of exercise we want in an arthritic dog now, when they couldn't before. That's good. And dogs that can play that couldn't play, that is nice, because dogs need to be happy. But dogs that were bedbound and now you take them and do a 10K, no, don't do that, because remember, you still got the same joint that you had. They're not perhaps perceiving the pain as much, but to go and take them up a mountain is probably
it's not cool. No, it's kind of really interesting, because somebody's already said that where is it that had increased water intake output, and she's had it checked out. Can we just because we've already gone for an hour,
something really important there, reported it as a side effect. If you feel, and you and your vet feel, that there is a side effect for any drug, you must report it, because whenever people say, oh, this drug gives side effects, and the the manufacturer says no, it doesn't, where is the truth? Well, if people don't report, you never know. And you can all report you can always report side effects of drugs. There is a way of doing it. So if you do prove a side effect, report it. And it might be that in the work that was done, even if you do a massive study, it's not going to be as big as when you launch a drug to the population. It may be that 1% of dogs drink more, and if you do a study on 200 dogs, you might miss that. But if you do it on 200,000, you might pick it up. You never know.
Absolutely.
Comments. These are probably a good comments.
So I was just going to pop up to this one. As far as I know, there's no studies that have been using it in that, but theoretically there shouldn't be a reason not to.
There's no contraindication. No, they will tell you that they haven't done a study directly on arthritic dogs with chronic kidney disease. But for me, that would be, one of the major benefits of it, as well as it being very cool and very clever, is that it doesn't have the same contraindications and side effects that other drugs might have. So, I think it'd be a good choice for a dog with
definitely. I'm just going to, this is a housekeeping thing. Sorry, guys, we don't do certificates, partly because I just haven't really got time. If you would like
to give yourselves a big pat on the back for watching this anyway. You don't need
if you want to do a little donation, you can. We'll do the big walk and email me and say, look, I promise I've signed up for the big walk. I'll write you an email, but it's just logistics, I'm afraid. Same with you, Adam. Really sorry. If you join the big walk, I might be kind and I'll write you an email. Gabapentin affecting kidneys over time, not something high on its list. I would have said that that's pretty safe, or if you heard differently.
Yeah, no, not as far as I'm aware with kidneys. It can cause some gastric upsets, but not so much. But the main problems that they experience, I mean, obviously it's licensed in humans, and a lot of the side effects they report are so psychological, which would be, bad thoughts, things like that, which dogs don't tend to.
Yeah, my cat Derek had to have some gabapentin this morning because he's not doing very well on his amantadine and his non-steroidal and his acupuncture and his all these other things, and wobbly. So I've got to cut the dose right down.
What about Silencia?
Huh? Oh yes, Silencia. No. That is a really good thing because that's the cat version.
Anyway, we're not talking about cats.
No, this I'm going to throw this one because I'm wondering whether you're going to go degenerative.
Well, we did once have a joke that for advertising we should write our company phone number, our hospital phone number on frisbees and give them out. No, I don't agree with that at all, because dogs should be able to run. However, if you have a dog that has got degenerative cruciate ligament disease, then they will go at some point, and if you do throw a ball for that dog, it will go quicker. So it is one of those, I can't remember what you just called it, a CL stick for dogs that have degenerative cruciate ligament disease. Yes. But not all dogs do, so you can't stop the fun for all the dogs if they are healthy.
It's
so
good.
I'm big on this. Like, this is why you need a diagnosis of disease, because when someone brings, sometimes you see a dog and it limped for a week, and they said, oh well, it's much better now because it's on all these supplements and these drugs, and we don't take it off the lead and all this. And you think this is a 1-year-old Labrador. No one's proven anything wrong with your dog. Go let it chase rabbits, please. Don't spend money on things you don't need. If you've got evidence there's something wrong, then yes, now we'll change all these things. But if you don't, dogs can run and play. This is why we have dogs. This is why dogs exist.
I think the only thing I would say to that, just because of my more rehabby type mindset now, is I just want owners to be aware that any mammal going from 0 to 100 with no prep is going to potentially do harm. So if you wanted to be really boring and go back to cam at the beginning, I used to do really weird things when I was doing cam on my own. And one day I took myself to the gym, totally overdid it, and I could not move for about 3 days. And I filmed myself and put it on cam and went, this is what it's like if you exercise your dog at the weekend, they've had no prep. It hurts, okay?
Yeah.
So just remember things like that.
You want to do the same level of exercise for the dog every day, pretty much, within reason. I mean, sure, you might take them for a nice walk at the weekend, but you don't do 0 exercise and then up a mountain. No, you're quite right. And a little bit of walking before you do anything, the dog does anything. But also, if you've got arthritic disease, then heat packs on those joints before you go for exercise and after is very good. Passive range of motion is very good. Same if you're doing sport.
There was another video I did of me trying to go down a slope that was icy and just went, this is what it's like for your dog, trying to negotiate pitch and floor.
And those fashionable wooden stairs.
The things that I used to do. Right, this one. I don't know what you're going to say to this one. Ready,
oh, I can see one. Can I read one out? Should the dog continue on Loxicon when they start Librela? I would suggest, it depends, speak to your vet, maybe very, very severe cases, but the way that they are launching it is that you should stop your non-steroidal after a week after the first injection. Now, that is because when they did the study, the first time that they tested the dogs for reduced pain was after a week. Therefore, they don't know if the pain management starts before those 7 days. So they're suggesting you give a week and then you stop. And I think unless it's a very, very severe case, it's worth trying it that way. You can always reintroduce it. So that was Denise. Thank you, Denise. Sorry, go ahead.
No, this one. So what else you advise? Should he still go on GABA? So I'd be wondering why calcified acetates in his knee. Osteophytes. He's on Umove and 4 injections of Carchafen. What else would you advise? Well, that would be a non-steroidal.
Okay, well, first of all, the cruciate surgery should have had major benefits in terms of the lameness because it will have stabilized the knee. But yes, non-steroidals. Maybe gabapentin on top of the non-steroidals, but I would do the non-steroidals. No.
I question whether the dog was still.
The dog is walking. I mean, the problem is happy is a word we must dissociate a little bit, because dogs can be happy when they are painful. Dogs are professional, happy people. They will be happy through anything. So the dog may well be happy, but he's in pain if he's got stiff back legs and he's avoiding hard ground. Now, first of all, if your dog doesn't like walking on hard ground, the sensible thing to do is not walking on hard ground. Because if he's avoiding walking on hard ground, probably he's got arthritis in his paws. And that, no matter how much pain relief you give, if you walk on gravel, it really hurts. So, but I would say if you've got stiff back legs, that animal is just in pain, but massively optimistic.
And I think owners, it would really help owners if we did a Facebook Live talking about how to assess pain, because it isn't just one thing. You can use a clinical metrology instrument to look at the history and observations. You've got your palpation skills of actually what's the dog doing whilst I palpate and move this. You've got your observation of posture and behavior. It's not just one thing that tells you whether a dog is pain.
But what I would also suggest for this dog is speak to your vet maybe about just trialing a non-steroidal for a month and seeing if you have a happy dog still, but who is no longer stiff. But your dog, the answer is your dog probably is exceedingly happy dog, especially if it's kind of a Labrador type. They'd be happy, whatever. But it sounds like it's in pain.
Sounds like it's still
I'm sorry, that sounds very emotive. It sounds like it has arthritic pain. That's why it's stiff. Would be my
You're getting so many lovely comments here. I'm not going to put them up.
No, good.
There was a guy up here. Here you go. How do I manage my 10-year-old large breed with arthritis in his hind limb as the other? What can I do?
This is a fantastic question. Now, I'm just going to branch out slightly before. Whenever I say there's something wrong with a dog's leg, instantly what people say is, oh my God, he's going to overcompensate. The other leg is going to go. No, the dogs can manage perfectly well. They're not going to overcompensate on the other leg. You might get some, if it's really severe, you might get a bit of temporary muscle pain. However, if you have a dog who is arthritic in the only leg they have at that end of the dog, then that is a problem, because clearly you're limited in any surgical intervention and the dog cannot limp because all their weight is on that one side. So this is where you need the correct body weight more. You need the correct pharmaceutical regime more. You need the hydrotherapy more.
You need the non-stick mat. You need the exercise advice. You need time with a physio to say this is what you can do. And
the mats are a big one there, because if this guy slips, he's going to not only fall and hurt himself, he's going to hurt his arthritic leg quite severely. So basically, you just have to do the same but more and be more focused.
Do the course, Andy. Do the course.
That does not mean the dog will not have a happy life, but you just got to be really on your game. It's just. Again, it's like a lot of times when I'm dealing with arthritic dogs, you say, okay, I agree, we wish we weren't starting from here, but now let's make it better. So a very good question. You just have to take the maximum care of that other leg.
Definitely. This one, your opinion, because there's loads of products out there, but I know what I say.
Yes. Okay. How do we find an appropriate omega-3 supplement? So the important thing with omega-3 supplements is that they are high level and high quality, and you need high. The problem we have with a lot of supplements is that it is incredibly hard to find out exactly what's in them and what's going on. Without wishing to advertise, the best proven are the diets that contain the high level. Now, those are prescription diets, and I know a lot of people don't choose that. So if you don't like giving the prescription dry diets, then you are going to look for a supplement as well. So things like the foods like Purina, Joint Mobility, Hills JD are fantastic. They are very, very good, and that's what I try and push people towards when their dogs are arthritic. If you are going to give a different food because either your dog can't tolerate those, or they don't like dried food, or you want to home prepare, then you need to find the supplement with the highest level of omega-3. And I think that's something, it's not necessarily that the vet will give you or prescribe you, but discuss with them. They may have a good one, or they may say, this is the one I recommend, go with that one. It's something that I would talk to them about before you buy a jumbo pack.
And I am going to big up somebody that's done some talks for us before. So Cecilia Villaverde, who is not only board certified European nutritionist, she's also American boarded. She has an independent nutritional advice service. So she doesn't work for any of the companies. She is completely on her own. And what is lovely about her is that she understands that owners have different lives. So some owners are going to go commercial, some want to be more home prep. she is cool. So if you are trying to find a nutritionist, get in touch with me and I'll put you in touch with her, because she is absolutely epic.
Another thing I would say is that usually to get high levels of good quality omega-3, you need to have an oil base in there. So foods can manage that. Capsules can often manage that, but sort of dry things maybe can't so much. But look at if you can find the dosage and it's a reliable one, then that's great. I would talk to your vet.
Yeah, talk to your vet, because I know a lot of people, when they're trying to hit the high levels of 100 mg per kg and above, you end up getting diarrhea and stuff. So you really have
I mean, you need to give a hell of a lot of some of these tablets to get to the right level.
And this one, I'm going to end tonight on this one, because I just find it quite a good one. It's Lynn. Lynn's doing some really good questions today. How do you know if it's pain without a mechanical kind of observation? So I think that's a big thing for people to go, oh my God, I never really thought about it. That limp could be mechanical or it could be pain. Just explain that to them before we kind of leave.
Well, I think, do you mean doing something like a pressure pad, an assessment?
I think for me, it's going back to what we said just before, that it's when you're looking at pain, there isn't just one thing. You've got observation, you've got behavior change, you've got posture change, you've got the palpation. And there is a tendency for people to go pain, but actually having a vet assess and feel that joint and feel the muscle and feel the dog and look at how they walk is really, really important.
So it is important that when we say that we treat pain in dogs, or we diagnose pain in dogs, what we're actually doing is that we are usually making an assessment on what we get the impression that the dog is interpreting. So this is why we don't talk about symptoms in animals. We talk about clinical signs, because a symptom is when someone says, I feel pain, I feel fear, I feel this. We don't know that with the dog, because we have to interpret their body language, if you like. So a mechanical lameness would be like in a cruciate ligament rupture, where whenever I stand on my leg, it shifts like this. Therefore, even if you magically remove all pain, the dog is going to be lame. When you get a pain lameness, there are a few ways you can tell. Firstly, you can associate it with a condition that is painful. If they have osteoarthritis in that leg and they are stiff getting up, the stiffness is because of pain. You can do a analgesia trial. If I think the dog is painful, if it struggles to get up or it's reluctant to jump out of a car, and I say, try these, whatever, non-steroidals for a month and see what happens. And if the symptom, the clinical sign that we associate with what we think is pain improves because we go in an analgesic, then we can see that is pain. You want to try and avoid kind of using empathy too much, but you can use your own perception. But this is why something like an owner questionnaire, a clinical metrology instrument, is so useful. Because something like the LOAD questionnaire, LOAD, Liverpool Osteoarthritis in Dogs questionnaire, has been designed because it asks you questions about your dog and what they do and how they interact with the environment. And it gives you a score based on those, suggesting whether there's arthritic pain or not. And I would say if there is doubt, that is a very good thing. And you can Google that on the internet, fill it in. Just be blatantly honest with yourself. Don't have a look, one mind on the score at the end. Just answer the questions and see what the score is. So that is what I would suggest in that case.
Yeah, and Lynn, don't feel emotional.
I would say lameness and stiffness until proven otherwise. I would say assume pain unless proven otherwise. I saw one out the corner of my eye, Librela or Cartrophen. If we're talking about an arthritic dog, Librela.
Oh my God. I knew that was going to happen at some point.
I just saw it there. I was like, no. Librela.
No.
Sorry. Not.
Lynn, please don't be emotional. Join Holly's army. They're always going to look after you. There's some lovely owners. And just, give us a shout in Holly's army. Have a look at the owner course. Look at the other CAM stuff. And you've said, can you find a vet in the Kent area that is on this kind of wavelength? I'm not familiar with people around Kent, and I don't tend to advise, but have you got any good mates?
In Kent? Oh, I don't know. No, I do have lots of friends in Kent, but they all seem to be horse vets. So I would probably actually just speak. You may find that you have a vet who is quite good at this, but is perhaps busy or doesn't know. Just ask. You know,
Just go back to them and say, can we
have this
take
conversation?
time?
Just say, exactly what you've written. Just say that to your vet. They may not have gathered from their discussion with you that, but they may be quite hot on this.
Yeah.
So have a good chat with them.
Well done on being a CAM advocate, Lynn. High five to you. You've
Well
done
done.
the course. Yeah.
Cool. I think
Look,
the thing
Jamie,
as well is like, don't get too upset about, you know, don't sit and worry about it. Discuss this with your vet. Do watch things like this. Know what to ask. You know, probably if you're on watching this kind of video, then you're probably doing sensible things. And I wouldn't worry too much. It's just keep making sure that the plan keeps up with your dog. That's the thing.
And keep communication open with your vet. You know, really, I think one of the things that upsets me quite a lot when I'm doing all the Holly's Army and the CAM stuff is when you can see that the relationship with them and their vet has started to break down when it hasn't even blossomed yet, because they haven't asked the right questions. They haven't said, I need more time, or can I see you at the end of surgery, or would you mind giving me an extra hour over?
I think one of the things that vets are very conscious of is they believe, quite rightly in some circumstances, that people do not want to spend an awful lot of money and do not want to spend money for that vet's time. And often people will be upset when they offer it, which means that people who actually want that often miss out. And you may find that your vet would be super happy to give you a whole consultation on this, but they're worried that you might not want it. So make sure they understand that.
Yeah,
I
absolutely.
think that's very important.
No, it's cool. Right, guys, I'm going to do a blatant plug because it's something I'm kind of semi-proud of. CAM has a book out. It's a children's book. It's very, very important. It's for parents and children to read together. And it's basically my dog, Holly, who sadly isn't with me anymore. But she is the flagship for CAM. And her legacy is this book. And it's basically trying to get families to be aware of how dogs are likely to express pain so that we can catch the signs of it early. And we don't get into situations where there could be an unnecessary bite or growl or grumble, and that loss of trust and the relationship, because that's heartbreaking as a vet when a family member comes in and says, oh, that was really grumpy, we don't like him being around anymore, you just can't trust him. There is often pain underlying these changes. So please purchase this book. It is in the shop. It is $8.99. All money goes into CAM. Did you know this, Jamie? If I sell this via Amazon, costs me 23p. If I sell it via the CAM online shop, CAM gets £5. What a difference that is. I know.
Well, there you go.
There you go.
But remember that if you sell it on Amazon, you're paying for someone to go to space.
Oh, that's true. Oh, well, that makes it okay.
Stop being so selfish.
I'm so selfish. I'm so sorry. Cool. Well, look, Jamie, it's always a pleasure. It really, really is. You're absolutely so loved. Everybody's saying thank you, thank you, thank you.
Yeah, I'm sorry I had a baby during the last talk and it was all delayed.
I know. It's all right. We'll get you back before you have your next one. 4 daughters. Oh, my God. That'd be scary.
I'll just, happy with the whippet. And
Just three. Thank you for listening, guys. I've got a really cool one happening on Thursday with the amazing David Levine, who is going to teach us about clinical examinations. So you can just get an idea of what your vet's doing. So he's going to examine an arthritic dog in front of the camera. We're going to look over the whole dog, all the things that he sees. And it's going to be amazing. All the way to the USA.
Actually, I'm resting my laptop on 2 books written by him.
I know.
He's a big deal. You guys should watch that.
Big deal. I'm going to get all blushy and I'll probably say silly stuff, but I'm really looking forward to it.
No, he's a really important guy. He'll say a lot of important stuff.
Cool. Right. See you Thursday, guys. Thank you very much for listening. See you later.
Yeah. Bye, people.